When you have focal therapy, you'll notice initially that your urinary flow is probably a bit slower afterwards. You may find you're passing urine more frequently and have to get up at night more than you did before. But generally speaking, that's relatively short-lived and can be helped just by avoiding caffeine and drinking at the right times. Sometimes, like with any procedure, you can get an infection in the urine or elsewhere, but we give antibiotics at the time, so infections are pretty unusual in the most circumstances. Bladder control is almost never affected, so you don't usually find men leak on coughing or straining, so you usually don't have that issue. Erections can be temporarily affected, so men may notice for a few months or sometimes 6 months or so that their erections aren't what they were, but usually at 1 year most men will find their erections are close or near to where they were before. Most men who have focal therapy or any form of prostate cancer treatment will usually notice that they ejaculate less or no semen, so that is also another risk of the treatment. But orgasm is preserved, so all men preserve orgasmic sensation. There can be very rare risks or very unusual risks, such as potentially affecting the rectum, but that's extremely unlikely unless you've had radiotherapy before.